So, good afternoon, everyone from Barcelona, for those of you who are connected online, and welcome to the second session of the Free Market Roadshow 2022. And, well, just to start with the presentations, I'm Guillem València, I'm the head of Global Programs of Institute Ostrom, and I'm delighted to conduct this panel under the title Smart Regulation in Healthcare After the Pandemic. So the reason behind this session is the situation that we all know after the COVID-19 pandemic started in March 2020. Halted operations and supply chain disruptions have led to many industries needing to adapt and learn difficult lessons, and this has resulted in a number of permanent changes for manufacturers, and especially when it comes to digitalization and agility. For the pharmaceutical, biotech and healthcare industry, a combination of high demand and pandemic-related restrictions have forced regulatory process to change in tandem. And the vaccine rollout is a clear example. For vaccines, there was no room for delays when it came to development, clinical trials, manufacturing, and distribution. Advanced market commitments, regulatory fast tracks, and expedited pathways were put in place. The same, however, can be said, at least in Spain, when it came to testing and tracing. Poor planning and mindless adherence to peaceful regulations led to suboptimal results. The pandemic has also accelerated the rise of digital health, a broad concept that includes solutions for telemedicine and teleconsultation, remote monitoring, connected devices, digital health platforms, and health apps. Digital technologies have been critical in the fight against the pandemic. They have been used, among other things, for online medical consultations from home and for increasing efficiency in diagnosis and treatment of patients through telemedicine, which, like teleworking and online education, has been a novel experience for many. But what are some of the main lessons learned from the COVID pandemic? How can we consolidate innovations in areas such as digital healthcare, telemedicine, or retail distribution of medicines and diagnostic tests? How will the post-pandemic drug discovery and development look like? Why is competition relevant for innovation, patient access, and well-being? I hope that to delve into some of these questions, we will be helped today with our four panelists. On the far right, Marc, General Director of the Catalan Competition Authority, an organization that ensures the proper competitive functioning of the markets in Catalonia and works to promote more competitive markets and regulations with lower barriers of entry. Next to Marc is Judit Vall. Professor Vall Castelló is an applied economist specializing in the analysis of econometrics and quantitative methods. She is a professor at the Department of Economics at the University of Barcelona and a researcher at the Barcelona Institute of Economics and the Center for Research in Economics and Health at Pompeu Fabra University. Her current research focuses on the analysis of the impact of COVID on the health and labor market, as well as the community of health professionals. Next to Judit, we have Frederic, we have Martí Jiménez-Mausbach. There was a change there. Martí is our very own head of research at the Ostrom Institute. He has international experience working in research, medical and regulatory affairs, business development and policy advice in Spain, Germany, Denmark, and the United States. Martí graduated from the University of Barcelona with a degree in biomedical sciences and completed a master's degree in drug development science at King's College in London. He is specialized in pharmacoeconomics, regulatory affairs, and healthcare marketplace. And next to Martí is Frederic Llordachs, Doctor of Medicine and Surgery with an MBA. He was a co-founder of Doctoralia, partner of Doc Planner Group, the largest online platform in the world that puts in contact patients with doctors and other health professionals. He is an academic collaborator of ESADE Business School and the Autonomous University of Barcelona. He is a founder of different startups and has recently resumed his entrepreneurial activities as CEO and founder of the startup Doctomatic for remote patient management. So without further ado, we start with the panel, and I would like to start with a question to Marc. The main objective of the Catalan Competition Authority is to guarantee and improve the well-being of consumers and users by ensuring the existence of competition in markets. Why does competition matter for the healthcare quality and innovation? What is the current state of competitive intensity in healthcare in Catalonia, Spain, and Europe? And what are some of the lessons learned after the COVID pandemic? Thank you.
Okay, thank you. Thank you very much. Thank you, Institute Ostrom, for the invitation. Okay, well, this is a very broad question, so I will try to highlight some ideas, and then if you have some questions, we can talk further on that. But well, let me start with a very basic idea, and I think that we all agree on that. That okay, competitive markets are in general markets where we have better prices, better choice, more quality and more innovation. So we all have, or we all want competition in markets. Of course, in some cases, we may have companies that do not properly compete among them, or there are some negative externalities that we have to correct, and then we need regulation and we need law enforcement sometimes. But the idea is that, of course, competition is good for prices, choice, quality, and innovation. And related to the pandemic, I would like to highlight two examples, one positive example and one negative one. Okay, the first one is that I think that during the pandemic we have all seen a good example of the benefits of competition with the development of the COVID-19 vaccine. Okay, in particular, I think that we have been observers of a very competitive race for such development, and in terms of competition, I think that the results are clear. We nowadays have about 5, 6, 7 vaccines around the world and commercialized around the world. There are more vaccines in progress and coming, so we have choice, a lot of choice. We have seen competition in order to develop vaccines with better quality. We have seen competition in terms of immunity, degree of immunity, less secondary effects, less number of doses, kinds of this kind of things. So we have seen competition in quality or an increase in quality, and of course we have seen a lot of innovation and with different vaccines using different principles. And no need to say that we have all been experts on DNA or RNA-based vaccines, for example. So we have seen a lot of innovation. So for me, this is a clear example of competition, and the question for me would be, so what would be the price, the quality and innovation of the vaccine if instead of having 5, 6 vaccines, we had only one choice? What would be the price? And the answer is, well, these are the benefits of competition. Okay. On the opposite, also during the pandemic in Catalonia and in Spain, we have realized how the retail distribution of several healthcare products, let's say medicines, but also products like masks or COVID-19 antigen tests. We have seen how this distribution of products is highly limited by regulation. Okay. In fact, we see that these products can only be distributed in pharmacies which have exclusiveness in a specific geographical area. And obviously, such limitations we have seen that have produced problems of accessibility in times of restrictions of mobility, and we have seen also higher prices of these kind of products. Okay, the problems with masks were partially solved with the issue of a new regulation limiting prices and allowing masks to be sold in supermarkets and petrol stations and in other places. Okay, I think that Judit will talk about that later on, so I will not go into details. But in my opinion, the price of the masks was reduced mainly because the introduction of competition in this area in the market with the new distribution channels. and not because of the price limitation. I think that the main effect on the price was to open the market with new distribution channels. Unfortunately, regulation that came afterwards with the COVID-19 antigens tests was not modified in the same way, and currently we see that COVID-19 antigen tests can only be sold in pharmacies, and for me this is a bad example on how regulation should be modified. On the other hand, we have medicines, okay, and we obviously retail distribution of medicines has to be strongly regulated in order to guarantee the safe and the rational use of medicines, and also to guarantee the accessibility and both geographically and in price of the medicines, okay. But however, during the pandemic, we have also seen some drawbacks on this regulation in terms of accessibility, mainly because these medicines cannot be sold online. This is prohibited in Catalonia and Spain, and this has created a problem of accessibility. And we have seen how citizens have been exposed to an unnecessary risk by having to go to the pharmacies to purchase the medicines that could be distributed through telematic means. And pharmacists has also been overexposed to the virus with unnecessarily increased social contact. Okay. Well, in this area, from a competition point of view, well, the ACCO, the Catalan Competition Authority, we published a document in December 2020 on competition restrictions in retail distribution of medicines. Okay, in that document, we concluded that many of the existing competition restrictions that we have in this sector are not fully justified in terms of necessity, but also not in terms of proportionality, and do not distort competition as little as possible. So in our opinion, the current restrictions in this market hamper access to the medicines and make the distribution system more costly for consumers and taxpayers, and a more efficient, less restrictive model would be possible if regulation were changed. Okay, in comparison with Europe, we observe that in Europe we have several countries that implemented processes for deregulating the retail distribution of medicines, and we also see that medicines can be even purchased online in Portugal, United Kingdom, Germany, Netherlands, Norway, many countries in Europe. And for all these reasons, the ACCO, or the Catalan Competition Authority, calls on the competent authorities to study the series of recommendations that we made in our study, many of which are in the line with the regulation implemented in several European countries, and these changes aim at increasing the welfare of consumers. And just finally, to conclude, for me, one of the main lessons learned from the COVID pandemic, from the COVID pandemic, and from our side, is that we have to adapt our regulation on retail distribution of medicines to a smarter one, a flexible one, regulation, with the technology playing a critical role in the center of this regulation. At the end, what we need is a 21st century regulation, which is going to be better for the consumers, for sure. Okay, thank you.
Thank you, Marc. If you have any questions, we have time at the end, so unless it's an urgent one. So we will move forward to Judit. Following up on the previous question, there's been a big debate around the price of COVID tests during the last year. Recently, the Spanish government set a maximum price limit for antigen tests sold in pharmacies across the country, around a third of the price they've been going for from before the regulation. However, competition restrictions in the sector of retail distribution of medicines have been the main driver of low access and high prices of tests. Can you give an overview of these restrictions? What can we learn from other international experiences? And how should policymakers respond to these dynamics to ensure access and affordability without distorting the market?
So thank you, Guillem. Thank you, Marc, for a brilliant presentation. So I think my question is very easy to answer. Liberalizing the market. I mean, I think this is the answer to the last question. It's pretty easy. It's pretty straightforward. But of course, as I am a data-driven person, I've collected some data that I'm going to present now. But I think the answer is very, very easy. To some extent, some of the arguments are very much shared with Marc. In fact, I used the report that the Catalan Competition Authority issued to revise some of the arguments, but I've also collected some data to back up these arguments, right? And to put it in context in Europe, no? In an European context. So basically, I'm first going to concentrate on restrictions in access, so competition restrictions. And then, of course, I'm going to follow with some evidence on prices, because, of course, restrictions in access are, of course, leading to differences in prices. No? And I'm going to concentrate in some European countries, and, of course, I'm going to concentrate on the COVID-19 tests instead of, the general view that Marc gave. So basically, starting with the access part, so here is a map. I've collected information on all these sources, The Guardian, País, Neutral, and I've built this map on, what are the type of establishments where you can access these tests, no? And basically, the first thing that shows up is that in the majority of these European countries, COVID tests are available in several establishments, right? In pharmacies, drugstores, supermarkets, and these are the green. I've painted them in green, right? So these are the good behaving countries, right? Then we have some other countries on the other side in this yellow color that it's basically Spain and Denmark, where you can only buy these COVID tests in pharmacies, sorry. So this is the other extreme, right? Only in one place, which are pharmacies. Then in between, we find the case of France, which is a bit special, because it used to be the case like Denmark and Spain, that you could only buy them in pharmacies, but then due to this huge increase in the demand in December, so around Christmas of last year, 2021, the government was forced to pass this new legislation in which they temporarily allowed these tests to be also sold in drugstores and supermarkets, right? And then, finally, we have two countries, which is basically Iceland and the UK, in which you could buy this type of tests were freely provided by the government, right? So you see here, Iceland provides free access to these COVID tests in some testing sites, and this is organized by the Ministry of Health of Iceland. And then in the UK, the government was also providing this free access to these tests until the 1st of April of 2022. So now, because it's after this date, you can find them in drugstores, supermarkets, and pharmacies. In fact, I was checking before coming here, and you can buy them in Tesco, you can buy them in Boosts, so you can buy them almost everywhere. So actually, these are now turned into the green countries, especially the UK, not Iceland, but the UK is now joining the Green Club in this sense. So basically, this is with respect to access. Now, of course, access is very much linked to prices, no? And whether they are available in some sites or others is also going to determine prices. And now I'm going to focus the second part of this short presentation on how these differences in market access are translated into different prices and in different periods. Basically, I'm going to be using Spain, Portugal, France, and Germany, and and so basically what we see here, so I gathered data for 3 points in time. So summer of 2021, December 2021, and here is a typo that I realized when I was coming, but the institute already had my presentation. So the last point, of course, is January 2022. So it's not 21, but it's 22. And so what do we see in summer 2022 and December 2022? What we see is the countries in which you can only buy these tests in the pharmacies, which are basically Spain and France, you see much higher prices than in the other two countries where access is liberalized, right? And you can buy them in many other places. And so the differences are huge. So in Spain, in December 2021, the average price, this is the average price, of course, for this test was 9.6 euros. Whereas, for example, in Germany, it was 2.5 euros. So these differences were huge. And this is, of course, due to the differences in these access points where you could buy them, right? Then, of course, from January 2022, these two countries introduced these new legislations. In particular, in Spain, the government introduced a capped price. And so, of course, you see the drop to 2.94 euros. And in France, the government introduced this temporary availability of these tests in other type of establishments. And of course, this forced these prices to drop. In one country, Spain artificially dropped because it was a price that was capped by the government. In the other one, of course, it was due to the competition, even if it was temporary. I want you to note also that even if the prices were greatly reduced, particularly in the case of Spain, they are still, in January 2021, they are still above the other countries in which there is free market access, right, or free competition. So even if the government capped the price, and of course it reduced the prices, it's still well over the other countries where access is liberalized. Also, these are the average prices, but for those of you living in Spain, you realized also that in the Christmas, 2021 Christmas, in some pharmacies, they were even sold by of a price of 15 euros. And so these are averages, but depending on where you live, this price was much higher. Okay, so basically summing up all these things, my point is, and maybe that's also one question that came to my mind when I was hearing the presentation by Marc, because you were talking about other medicines, but in this case, which I think it's more complicated because there's prescriptions and things like that. But in this case, I think it's very clear because tests do not require a prescription. So in this case, pharmacies should only be used mostly for these products that you require this regulation, that you require this follow-up, that you require these prescriptions. In this case, this is completely unjustified because you don't need a prescription to get a test. And so it's completely unjustified why you can only buy them in pharmacies. That's the limitations that are unjustified. But then, of course, these limitations lead to three main consequences. First, reduced supply, which also Marc was talking about it. So you reduce access to an item, a good, that is crucial in order to control the pandemic. And so, even in terms of public health, this is a big mistake, I think, from my point of view, because it makes it much more difficult to control the pandemic. Then, of course, it leads to higher prices, right? Particularly in times of an excess of demand. And then finally, it introduces some sort of protectionism of the owners of the pharmacies, which again is completely unjustified. And it introduces this discrimination with respect to the other customers, to the other citizens. So one question is, which I already talked about a bit when I talked about the prices, is capping the price a solution like the Spanish government introduced? Well, I don't think so. First of all, I don't understand why this is put forward as a solution instead of liberalizing the market. So I don't understand why this was the, well, I do, but it's quite unjustified. I do understand the arguments, but when you look around and you see the other European countries doing something different and it works out for them, so I mean, come on, it should give you more arguments to also do that. But apart from that, I think there are two elements in the economic reasoning that are also very much against this price capping. No? First of all is that, of course, the final price is going to be very, very dependent on the moment at which you decide to cap the price, right? And if you do that, like in Spain, in a moment where demand was very high, of course, you're going to set a higher price than what it should be. Right? That's one thing. And then the second thing that we also saw in the graph about prices is that, of course, then when demand is reduced, the price is capped, so it will not fall this price as it would have fallen in a market, in a competitive market. So I think, so I think price capping is not the solution. I think it was easy for the government, from my point of view, to liberalize the market because the other countries in Europe were doing that. And some of them from the beginning, but even France, like, for example, at some point also changed the strategy, the public health strategy in that sense. And so for me, it makes it very difficult to understand the reasons and to justify why the Spanish solution was introduced this price capping, because it does, from an economic point of view, from my point of view, it doesn't make any sense at all. So thank you very much.
Can I ask just one? In the U.S., a drugstore and a pharmacy are the same thing. You're describing them differently.
Yes, yeah, right. So pharmacies are the only ones allowed to sell prescribed medicines. And drugstores, you can find many products like creams and things like that, but you cannot buy prescribed medicines in drugstores. That's the difference. I don't know if it's clear.
But drugstores and pharmacies aren't combined like in the U.S.?
No. They are different things, yeah.
Yes, no, pharmacies.
Huh? Oh, maybe you know better, but...
No, the point is, pharmacies used to have a drugstore part, so they get the money, they get the people coming because of the drugs, but they get the money from the over-the-counter sales they do. So at the end of the day, most of the pharmacies are a drugstore at the end of the day.
Well, sell some products that are, yeah, but the drugstores cannot sell the prescribed medicines.
Not in the opposite.
Yeah.
I think it's the most visible in the UK, because you're going to have some of the stores that aren't pharmacies, but they're selling over the counter, but they aren't pharmacies per se.
Mm-hmm.
Yeah, that's what I was going to say, that in the UK you can actually buy medicines that do not necessarily need a prescription on a drugstore.
Thank you, Judit, and everyone for the interventions. So I'll move to Martí. At the Ostrom Institute, you've coordinated an extensive report analyzing and discussing several opportunities for smarter regulation in healthcare in the face of the COVID pandemic. Can you highlight some of the main takes home messages? How will the post-pandemic drug discovery and development look like? How can we learn from fast-track regulatory approvals and coordinated investments in manufacturing and distribution? And how can regulatory reform offices can take a more innovation-enabling approach to regulation?
Yes, so thanks, Guillem. And I may start by saying that I pretty much agree with my fellow panelists that actually the pandemic has given us the opportunity to really assess how can we collectively simplify and expedite procedures through smarter and innovative regulation. So I think we shouldn't waste this chance to actually re-examine how, whether those regulations were in fact ever needed on the first place, and how can we move again to set smarter and more flexible regulatory frameworks for the years to come. And this is actually why I believe that it makes a lot of sense to have this fora as well to discuss these very relevant topics. So just to reinforce what Marc and Judit were introducing a few minutes ago, I think in this country in particular, it's important to keep spreading the message that an anti-competitive regulatory framework or environment raises market entry costs, distorts the allocation of resources across different sectors of the economy, it leads to lower quality and innovation, it increases prices, and therefore eventually reduces social welfare as well. So this might be obvious to most of you in the audience today, also for those of you dialing in online, but I think we need to really keep spreading this message, and this should be way more present both in the media and also in the policy sphere. And then delving into the report that Guillem was alluding to, so in the report we discuss opportunities for regulatory innovation mainly in the context of the pandemic, and mainly in 4 key dimensions or domains. So the first one is regulation of healthcare professional associations. So Spain is one of the EU member states in which professions are subject to most control and regulation, and this is particularly cumbersome for healthcare professional associations as well. So there should be way more opportunities for voluntary membership, and also what we call collegial pluralism in Spain, particularly for doctors and nurses as well. Next, we focus on workforce mobility, and more specifically on the homologation of university degrees or academic curricula by foreign health personnel. And I think this will be particularly interesting also in the context of the Ukrainian conflict, Ukrainian crisis, or the invasion of Russia in Ukraine, because we'll have, of course, Ukrainian refugees coming. Some of them might be medical personnel, so either HCPs, healthcare professionals, or nurses. And I think, at least at the moment in Spain, they would face a lot of red tape in order to be able to work in our healthcare system. So I think we really need to make sure that we get smarter, more flexible regulation when it comes to the recognition of their academic curricular and also professional competences moving forward, because of course we are talking about non-EU citizens. Then moving on to distribution and dispensation of pharmaceutical products. So I won't extend too much about that, because both Marc and Judit have brilliantly exposed some of the main issues we are facing right now in Spain. But I would like to highlight that in times of a pandemic, online pharmacies were crucial, but most European countries still didn't allow them. So in Spain, as my colleague was alluding to, direct selling of prescription medicines is prohibited or forbidden by the Article 3 of the Medicines Law, but there are 7 European countries that do allow patients to order prescription-only medicines online. And these are Sweden, Denmark, Finland, the Netherlands, the UK, Estonia, and Germany. So as always, and as surprising, and this may sound, especially in these latitudes, Scandinavian and Northern European countries seem to be much better when it comes to consumer choice, pro-competitive regulation, and in this case, allowing patients to order medicines online. And then if we move, also as Judit was alluding to OTCs, to over-the-counter medicines, this can only be sold online, and only if, in Spain, this is made directly from the pharmacy store. So there cannot be any intermediaries, so no Globos, no Delivers, no Ubers, no other sort of online platforms or competitors introducing competitive pressure in the market field. And this, again, is in contrast with many other European neighbors, so Denmark, Norway, Italy, Hungary, Sweden, Germany, the UK, they all allow distribution of OTC medicines by non-pharmacy retailers, and this includes, as Judit was saying, supermarkets, hypermarkets, petrol stations, but also new online platforms entering the market. And as Marc was pointing out, I think we also need to bear in mind that we actually have empirical data to back up our sort of reforms and policy proposals. So supermarkets in Portugal charge about 20% lower prices than pharmacies, and outlets charge around 4% lower prices for OTCs as well. So this means that actually allowing entrance of these new competitors in the market have a greater, greater access for medicines to patients, and that of course implies a net increase in social well-being. And then I would like to spend a few minutes to discuss what I believe is also a very relevant topic when we are discussing innovative regulation in the context of a pandemic, but then I will focus more on the aspect of drug development itself. So the average time between identifying a novel pathogen and developing a vaccine used to be 48 years. This comes with some tricks, but I will delve into that in a minute. But last year, we were able to deliver multiple safe and effective or efficacious vaccines in less than a year. So 48 years, 1 year. So this achievement, I believe, continues to be extremely underrated. So it is truly remarkable that not 1, but 3 vaccines were granted emergency use authorization by the end of 2020. So just 11 months after the SARS-CoV-2 sequence was published, and just 8 months after the first patient was actually enrolled in clinical trials. So of course, this comes, as I was saying, with some tricks. So it is true that the mRNA technology was in the lab since the early 80s. It is also true, however, that the huge improvement in the mRNA gene editing toolset and also the huge deployment of clinical trials for vaccines really happened in such a time span. So in a very, very short time span comparing to previous vaccine development programs. So why was that? So first of all, I would highlight the collective effort that was channeled, for example, through Operation Warp Speed in the US. But more generally, we talk about advanced market commitments. So this is a sort of policy design devised by Nobel Prize of Economy, Michael Kremer. So it can be summarized by saying you pay first and you develop later. So it's sort of an incentive that really allows to coordinate, in this case, drug manufacturers with the need to deploy fast vaccines by reducing risk by the drug developers. And then from a regulatory perspective, there are also, I believe, some lessons to be learned. So many, as I was saying, many of the factors that actually helped compress the timelines were quite unique on the COVID vaccine, and they cannot likely be replicated for future sort of crises or healthcare areas. So, for example, the fact that the trial readouts were available much earlier and with much more data than with any other therapeutic indication, and that's due to a dramatic reason, which was the high numbers on the pandemic, and then also the repurposing of some drug product and drug substance manufacturing facilities that were initially used for some other therapeutic or drug development programs, and then were repurposed or reutilized for the COVID vaccine deployment, and that's, of course, also due to an emergency situation like the one during the pandemic. But I think, however, that some of the lessons can be still applicable for the future. So, for example, regulatory applications for the first human doses were processed in less than a week instead of the typical 30 days. And then what we call rolling regulatory reviews, which means reviewing while the data is being generated and not after the data is generated by clinical trials. I think this will also become more and more relevant for other disease areas with high unmet medical needs. So what are other ideas that we also explore in the report? So for example, we know that traditional marketing authorizations are usually binary, right? So either yes or no, either approved or unapproved, red or green system. And we know as well that this usually favors shorter clinical trials in which no outcome variables can be studied, and these are usually replaced by what we call surrogate endpoints or intermediate variables, which are sometimes less meaningful from a clinical or patient perspective. So in this report, we encourage policymakers to explore the implementation of new, more flexible regulatory procedures, such as, for example, the introduction of conditional or adaptive authorization schemes. So this means monitoring real-world evidence and enriching the data packages as new information becomes available, as this was done, again, during the phase 2 trials for the COVID vaccines. And then we also encourage policymakers to explore the creation of what we call a two-way authorization system. So on one hand, you have the sort of the traditional pathway, where you have phase 1, phase 2, phase 3, first in human or proof of concept, clinical exploratory and clinical confirmatory. But then on the other hand, we also suggest that it might be interesting to strengthen what we call the compassionate use of medicines. And this is actually being already used in some patient populations suffering from chronic or extremely debilitating diseases for which no alternative treatment exists. And this might sound a bit risky or even questionable from an ethical perspective, but the reality is that in the real world, doctors are doing this all the time. So this is what we call off-label prescriptions. So we have drugs that do have an intended label of use, but then we know, due to literature reviews, due to HCPs actually going to conferences or talking to colleagues, that based on the clinical practice, they actually prescribe medicines for other therapeutic indications as well. And this was actually also an interesting experience with some of the antivirals used during the COVID pandemic, which were repurposed versus other that were in development. So I think this sort of double pathway is something to explore and something to discuss in the context of future healthcare challenges. And very interestingly, actually, and that's just as a final note, Japanese law, and I can tell you that I've been working with some of the Japanese regulatory authorities like PMDA. They are not known to be very flexible. They're actually quite stringent. But in this case, Japan has implemented the basis of this two-way system for regenerative medicine. So for regenerative medicine, so this means stem cells, tissue-based medicines, etc., they're actually applying this sort of concept where they have a two-pathway, where one for the traditional sort of medicinal products and one for this new therapeutic modality. So actually, conditional approval for these medicines means that patients get early access even like 7 years before what they would normally get with a conventional approval system. And throughout these 7 years, there's still rolling value of data which is being generated by the patient using these medicines, but again, they have granted early access on this treatment through conditional approval for either stem cells or tissue-based medicines. And this system, and I think this is also very interesting, we've talked about data, so this system actually is introducing what they call a drug evaluation database, and this is an open access database that would contain all the results of the drug treatment of these new therapeutic modalities and also the most relevant biomarkers, so that actually you can stratify patient populations and say, okay, maybe for this specific patient subgroup, this treatment modality is more interesting and not so much for the others. But again, we need data, and I think from a regulatory perspective, we need this dynamic or more flexible rolling regulatory reviews that enrich the regulatory framework with data along the way. And this is something that physicians can use. They can utilize these new systems. They can be empowered. Again, similar as they do with off-label prescriptions, but in a more sort of settled and, let's say, regulated framework. And I have other ideas to mention, but maybe I will leave it for the discussion afterwards. But thank you.
Thank you, Martí. And if there is no urgent questions, we'll move to our last panelist, Frederic. Frederic is a co-founder of a successful e-health startup, Doctoralia. That's the largest global platform for healthcare search and accessibility. His new project is Doctomatic, a remote patient monitoring tool. He's also advising startups that maybe have lost the market train or helping big traditional companies to understand and get involved in the digital health innovation arena. The COVID pandemic has spurred digitalization of healthcare systems and infrastructures. Will these transformations prevail? Barcelona has a blooming ecosystem of startups developing digital and telemedicine solutions, but is the healthcare system and the Catalan healthcare system ready to purchase and utilize those innovations? What are the main regulatory hurdles, and are they related to privacy, liability, cybersecurity that I use?
Well, thank you first of all for having me here. It's a pleasure. So I am probably the less brilliant in this panel, so don't worry. But the good thing is that I have something that they don't have, that is the digital health arena. That is, they talk about the touchable things, I will touch about the intangibles in some way. You know? But something that it could be very easy. The other thing is, sorry for my English, that's learning Salou next to the beach. So then I am not responsible for what can happen with my English. Well, the point is, you mentioned that if the COVID pandemic has spurred digitalization of healthcare system infrastructures, and the question if this will prevail, in short, is no. No, because in fact there is a. Let's start with my experience. I will talk not about the figures, about the studies, but about the experience that we had. I was during all the pandemic, during all the close-up, trying to give as a gift a telemedicine tool for any hospital around Spain and even abroad. And the point was that it was very difficult. Was very difficult to find somebody interested, somebody that was willing to have this new task on charge of becoming digital, of transforming to the digital assistance from the physical, let's say, and well, this is the reality. The reality is that the healthcare world is not ready to jump in one day to a digital environment. Instead of having all the patients ready for that, because we must remember that Spain has more than 90% of users of smartphones. Okay? 90% of the population, more than 90% of the population has a smartphone that is connected. So of course there is a digital breakout in some way. So there is a part of the population that is lost in this digital path, but it's only 10% of the people. So we can keep all the services ready for all these people, and on the other hand, just advancing into the digital space, which is the main problem. So there are several problems. One of that was the opposition of the competition, the lack of competition we have. So there was a medical devices reglement change in the European Union in 25th of May of 2017 that has lasted for 3 years of how do you say it, the time to be applied, that has motivated that any medical device you want to launch to the market must have clinical trials over instead of using the similarity with other solutions that are in the market. Okay? What's that? That's a lobby, a medical devices lobby movement to protect their interest for new tools coming from innovation or from cheaper countries like China, importations that easily had the CE mark. And the problem has been that because of that, there was a lack of pulse oximeters here in Spain. So I have had phone calls of hospitals here in Barcelona asking for these devices. They were using veterinary oximeters with people because there was no way to get one of that. Okay? So over-regulation is good since we have a real problem in the table. And there is an over-regulation on that. And this is a problem for innovation. So we have everybody ready. We have, even you mentioned the Barcelona, the blooming healthcare ecosystem of startups with digital health and all that stuff. In fact, 30% of the startups that were in the last Mobile World Congress space for startups, the 4 years from now, were dedicated to digital health. 30%, that is a lot. It's a massive, this year has been the year of digital health in the Mobile World Congress. And the point is that Catalonia is not ready to have a sandbox, public sandbox, or even a private sandbox to test new digital health solutions, like in other industries, like in fintech, like in many other startups have that. Okay? And it at least is funny. So we are very proud in Catalonia to say that we have the best healthcare system in the world for years. And this is something everybody has in mind, but this is, well, maybe it was 30 years ago, but not now. And this is something realistic we should have clear for the only way, if you have a new digital health tool and you want to go to the market, to a public market, you must convince somebody in a hospital that really sees that, come on, this is an advantage, and then go with the hand, with the shaking hand, to the Catalan Agency for Health Quality and Assessment, and they will say you if this is good to be paid for a public for the public healthcare system, but only once. So then you must go to every hospital and doing the same. They say that is the same system they have in the UK, but I love to remember to the people that NHS is broken. So they have about, I don't know how many trusts are absolutely underpaid and are underinvested. So it's not the best solution, in my opinion. No? So if you want to have innovation for the population, and I'm talking about Catalonia, but I could say the same for Spain. We have 17 countries around, so that the rest of countries, of regions that have a similar politic about that. So you can't have a startup and then suddenly be a public provider. Right? And this is then is when we have great surprises when people take the companies and move to Silicon Valley, or move to London, or move to Berlin. That's a big surprise. So how they move that? Because there is money, there is people willing to use you, and there is a regulation. FDA has a short list for these digital health tools, and you have 1 year to get the data, and then they say you okay or you are out. Even there is the DIGA. I don't know. Sorry for the German speakers, but the DIGA is the digital therapeutics German pathway for new therapeutics that works, and they are more strict than the law is, than the regulation is. That is, okay, you have a CE mark, and then let's check if you really do what you say you do. The CE mark, and then the clinical trials or whatever, depending on what you do. You have 1 year of trial. They pay you for 1 year, and at the end of the year, if it's okay, you are in the system, you are in the list, and then they can use you. Any doctor can prescribe you, and the public healthcare system will pay for that. And the point is, they have 31 startups. Last week there was somebody was out of the list, so they have 30 now. So it's not for everybody, and it's a long shot. So you have the CE mark, that's a long pathway, and 1 year to be tested, but you are paid this year, so you have the incentive to be there. And then everything is in German, so it's usual. So it's not easy to get into the market, but at least it's a massive market, and they accept you. So there is not a path here in Spain for that. France is doing similar things, Belgium is doing similar things, the Netherlands is doing similar things. Even the UK is looking at that in some places, because they know that they need new things to give a better service and treat better to the people. And I'm not talking about telemedicine, so if you want, I don't know if I have time to talk about how difficult is have a telemedicine tool to sell it to the public healthcare facilities. Instead, they need it. Even for free, it's hard to do that. The other thing is that they are developing their own tool with public providers that is not finished, and it's 1 year late, so not bad. Okay, so I don't know if this is good for the citizen. For the citizenship should know that, but nobody talks about that because, come on, we have the best system in the world. Okay, so, well, nothing more to say. So I could be till tomorrow talking about that, because as you see, I'm not passionate at all because of that, but well, it's my pleasure. So if you need any question, I will say something. I don't know what we'll say.
Thank you, Frederic, for your intervention. So we are just over time, but I'm sure we can give the panel 10 more minutes to like the closing remarks. And I would like to hear like a quick, brief impression of each of you about the topic of the panel, smart regulation in healthcare after the pandemic. What would be your take in each of your work ambits of a smart regulation in healthcare to move forward, to use tech to improve the health system, the competition, innovation, all these matters. So maybe we can start with Marc and move forward.
Okay. Yeah, first of all, Frederic, I completely agree on what you say, and I think that we all remember during the pandemic when some car manufacturers were trying to produce breathing machines, and they couldn't sell it to the healthcare system because it was not, they had problems for the homologation, and the same for the mask and everything. So this is something that clearly has to be changed, and the idea of a sandbox regulation, I think it's a very good idea. So if you want the ACCO to support...
It's not mine, so...
if you want us to support that idea,
I will call you.
we can work on that. Okay. But basically, I think that we should put technology at the center of the new regulation. I think that we have a very old-fashioned regulation, designed for another kind of healthcare system, and designed maybe, I would say, to protect some people or some businesses. And we have to change that, and we have to put technology at the center and to make a 21st century in terms of regulation. And if we look at the retail distribution of medicines, what I was talking about before, I think there is no justification. I mean, we have the technology, we have everything, and there is no reason why we are not, we don't have a system, or why we cannot buy medicines online. Even for those against liberalization, we could think about a public system. I mean, we could think about a public system supported by pharmacies and delivery companies, And we could discuss if we want a public system selling online or we want a private one, and we see the efficiencies, but the technology is there, and we have to put technology at the core of the regulation for sure.
Thank you, Marc. Judit?
Yeah, so I see a positive and a negative note, and I think it's a good way to end the discussion with these two sides of the story. No? I mean, for me, the positive note is that I think something is changing. So I was looking the other day at the renovation plans for Hospital del Mar, and I was so surprised on the amount of technology and digitalization that these plans include. So I think something is changing, and I think this change has been kind of accelerated by the pandemic, because people in general, the citizens, but also politicians have realized that we need a different healthcare system. And I was, as I said, I was very surprised to see that the plans, the 5-10-year plans of renovation of one hospital, but all of them are in the same pace, include, very strongly the digital part and the technological part. So I think something is changing. We are moving on the right direction. Now, the negative note is I don't know, or I have doubts on how quickly this change is going to happen, and whether it's going to be quickly enough for what we need, or as quickly as we need it to be. And I think that's my negative note, and that's my worry right now, because we are already in delay, and yes, we have activated some things, but again, I'm not sure how quickly this is going to happen. And then I think that we need it quite rapidly, because for the population as a whole, but also for healthcare professionals. So I have this study that I've done with the Professional Association of Medical Workers in Catalunya, el Col·legi Professional de Metges de Barcelona, in which we quantify the deterioration in the mental health of health professionals during the pandemic, and it's huge. I mean, it's really, really impressive how the pressure that they have been suffering during these 2 years has made, a mark on their mental health and on their, physical and mental state. And so I think they also need it from within the system, right? So I hope that they have realized it. I think they have realized it, but I hope that they also realized the need of this to happen rapidly.
Yeah, I mean, I can just echo what Marc and Judit just said. We need a higher degree of flexibility. We need dynamic regulation, which is able to fit in data and information, as Marc was saying, when it comes, instead of having such enormous ex-ante restrictions to competition for entry competitors into the market. I also think that sandboxes are a great idea. They are used in fintech. They should be used in digital healthcare as well. We've worked on that also at the Ostrom Institute, but then never underestimate, and this is, I mean, it was just an ironic question that Judit was raising before, but of course there is a reason for all these regulations. There are incumbent actors really approaching the policymakers and making sure that these pro-competitive regulations are not put in place. So I think it is really necessary to make people and society understand that we are doing that for the benefit of patient access, lower prices, higher innovation, higher quality, and higher social well-being as well. And then maybe as a final remarks from my side, in drug development, as I was saying, I would enthusiastically encourage also maybe greater convergence between regulatory authorities, which is a bit contradictory with sandboxes maybe, because on one hand we do need experimentation on the local level, but also in the pandemic, for example, a greater convergence or harmonization between FDA, EMA, and other regulatory authorities would have been quite useful from a drug development point of view. As I was saying, new flexible pathways, so conditional approvals, potentially double pathway authorizations, compassionate use of medicines, and so forth. Of course, getting rid of all the nonsense entry barriers for retail distribution of medicine, so online prescription, online distribution, geographical barriers, vertical and horizontal integration of pharmacy offices, the fact that you need to be actually in Spain, which is completely nonsense, you need to be a pharmacist, not to prescribe, not to dispense medicines, but actually to own a pharmacy office. So again, this is mainly due to not economy or policy, but mainly political economy reasons and the voice of incumbents in the policy debate. And then maybe as a final note, and I'm not going to extend on that, but I would really encourage you to read one of our latest reports, which is pretty interesting, and it's also related to the topic of smart regulation in healthcare, which is compensation of voluntary donations of plasma in Spain, which is a very relevant topic. So there's been a sharp decrease in plasma donations all over the world. There's only 5 countries, and these are Germany, Austria, the Czech Republic, the US, and Hungary, which allow compensation of plasma donors. And these countries, which represent, I think, quite a low, I would say less than 10% of the world's population, they actually supply around 90% of plasma-derived medicine. So this includes immunoglobulins, albumin, so all those hemoderivatives used for patients with immunodeficiencies, hemophilia, and other blood disorders. So quite an interesting topic also from a smart regulation in healthcare perspective. Yeah.
Thank you, Martí. And Frederic?
Well, being the last is always an advantage, because you know what not to say. So it's, well, you know that coming back to the topic of the doctors, the point is that everybody thinks that the system, the healthcare system is something that nobody can touch. Yeah. No, so it's untouchable. It's like an obelisk in the middle of nowhere that has to be preserved and things like that. When in fact we should be trying to improve it as better as possible. So especially because we need to give a better service. So people, we are living in the Amazon era, so the Tinder era. So everything is right now, is for today, is at home, and they want it, and I want it now. So it's not about having a 24 hours line in the emergency room as in Barcelona hospitals happen. Okay, so, and how can you change that? Just putting technology on it. All of you have been mentioning, and I'm very happy to be here with you. Again, I'm maybe not the brightest in the table with the figures, but I really appreciate that you are in the same mood, because it's the idea is that technology should help us to do more with less resources involved, with less time involved, with less problems involved, and with less working load for the professionals, healthcare professionals, that really, imagine the guy that's playing the piano, and is all the party playing the piano, and it's the morning time, and then you change to an after hours, and you still have the guy in the piano, okay? So this is the healthcare professional, still playing the piano, and you're asking for new songs. Oh, another one, and you still, and they, come on, man, okay? So think about that. So we need a CD, or we need well, a Spotify, now that's in Barcelona as a sponsor, a Spotify to work for the doctors in order, and for healthcare professionals, in order to have a better healthcare for all of us that we are the citizens. If you come from abroad, you want also a good healthcare, okay, let's put technology and let's help everybody on that.
Thank you, Frederic. So I don't know if there is any question that you would like to direct to any of the panelists. And if not, I think we can have a round of applause, and I'd say see you in the next event. I don't know when it will be, but thank you.
I think Scott would know. Maybe if you want to.
Yeah, sure. I can give some verbals round of applause. Yeah, sure. I think you mentioned something about a few minutes just closing or whatever. It's not going to be a few minutes. It'll be like 1 minute. No, next event, at least in our Spanish tour, is tomorrow, 5 p.m. in Madrid. So No, yeah, one of the things actually just reflecting on both of the panels as well as Dan's keynote at the outset, one of the things I'm coming to enjoy a great deal about the Free Market Roadshow in general is the diversity of topics and approaches. So I've come to this from yesterday being in Castellón and listening to a fantastic presentation on Oswald Spengler's Decline of the West. It was very philosophical. I don't know if I really understood much of it, not least because it was in Spanish, but which I started learning about a month ago, but that doesn't necessarily entitle me to follow a complex philosophical discussion on the decline of the West and Western decadence. Nevertheless, so I went from that, to diversity of topics and approaches, to here, which I think was defined so much by strong empirical work, very evidence-based, data-driven, and I think there were some unifying key points to take away from all of the discussions. For example, all three talks focused on key issues that really affect our future, be it health or taxes. Incidentally, I'm reminded of that quote, I think from Benjamin Franklin, right? Dan, you probably know this better than I do. What is it? There are only two things that are certain in life: death and taxes. And I think that you could add to that the third thing, which is the need for energy. And so that touches upon the first panel as well. I think also all of the panelists pointed to potential social challenges to bear in mind and room for future research and work. Some of the discussions, I think, were rather dire. For example, at the outset, and we have his lordship, Dan Mitchell, to thank for that. But I think ultimately all of them, including Dan's presentation, were solution-oriented, because sometimes I think in conferences like this, where people have a shared sort of philosophical outlook, there's a tendency towards excess optimism or pessimism, and this one was thankfully not subjected to paroxysms of enthusiasm or outrage, and I think that's important, because for reasons that were mentioned, I think, by Julia earlier, the perception is important. The message and the benefits need to be clearly defined and communicated to people. So in other words, what I'm saying is that this conference is exactly the sort of thing to present to politicians and decision makers, and so I commend all of the speakers for that, and I, above all, thank the Ostrom Institute Catalunya, and actually no, above even the Ostrom Institute Catalunya, I thank all of you for being here in person and everyone who joined us online. Thanks a lot.